legal action looks to restore abortion rights in Idaho. The Center for Reproductive Rights filing complaints in 3 states where women have been denied abortions despite serious medical concerns. Our anchor Karen Larry is at the State House to explain the latest on this lawsuit.
The most recent legal challenges come in Idaho, Tennessee, and Oklahoma, the 3 states among 14 that have adopted near total abortion bans since the reversal of Roe v. Wade. In Idaho, patient plaintiffs say their lives were put in jeopardy, told they could not receive an abortion despite their fetuses being diagnosed with fatal conditions.
They were surprised I was still pregnant, given the severity of the conditions.
Idaho mom Jennifer Atkins is among the plaintiffs in a new lawsuit challenging Idaho's abortion bans.
I was devastated.
Jennifer and her husband learned at their 12-week ultrasound their fetus had a fatal condition.
It's hard to imagine, but the news got worse from there. We were told that if I attempted to carry my pregnancy to term, I was likely to miscarry, and that the longer the pregnancy progressed, the greater the chance my own health would be in serious jeopardy.
But in Idaho, abortion wasn't an option. Current law outlining an exception to prevent the death of a pregnant patient, leaving doctors to decipher legal language with their license on the line.
They do not know how close a person needs to be to death before they can provide them with stabilizing, life-saving abortion care. This simply cannot stand.
Plaintiffs in other states with similar laws told to wait in the hospital parking lot until their condition became clearly life-threatening.
He asked, "What am I supposed to do if she starts bleeding again?" And with sympathy, they did tell him that they couldn't touch me until I was crashing and that we should wait in the parking lot until I was about to die.
In Boise, OBGYN Dr. Emily Corrigan routinely treats pregnancy complications and says the last year has been the most difficult in her career because of the new abortion bans.
There is still widespread confusion in the medical community in Idaho about in which circumstances abortion care is legal, even 1 year later.
Doctors who break the law could face prison time and tens of thousands in fines, something Corrigan says is pushing professionals to leave the field or leave the state.
At least 19 reproductive health physicians have left Idaho or retired early within the past year. We have lost 5 out of 9 maternal fetal medicine specialists.
Atkins and other plaintiffs hoping to restore access to abortion in Idaho as a health care issue, not a political one.
People in Idaho must be able to make informed decisions with their doctors without the intrusion from politics. What I needed was an abortion, a safe and standard medical procedure that is often required to save lives and keep families intact.
Among other requests, the 92-page lawsuit ultimately looks to let Idaho doctors act in good faith when treating their patients, allowing them to perform abortions when it puts the pregnant patient's health at risk, including concerns for future fertility. I reached out to both the governor's office and the AG's office for comment on the new case, but have not yet heard back.